What first aid can you do with no supplies? Imagine being in an emergency where there are no first aid kits around. What can you do to help someone in need using only your hands and everyday items? Let's find out how you can make a difference in those critical moments. First, always make sure the scene is safe for you and others before rushing in. Check if the injured person is conscious by gently speaking to them or tapping their shoulder. If they respond, stay with them and keep them calm. If they don't, call emergency services immediately. To control bleeding without supplies, use clean clothing, a t-shirt, or even a towel to press firmly on the wound. Applying steady pressure helps slow or stop the bleeding until help arrives. If someone has a broken bone or sprain, support the limb by stabilizing it with rolled-up clothing, a sturdy stick, or a piece of cardboard. Hold it gently but firmly to prevent further injury. For burns, cooling the area is key. Use cold water, juice, milk, or even beer if nothing else is available. Keep the burn submerged for at least 20 minutes to reduce tissue damage. Cover the burn with a clean plastic bag or a nonstick cloth to protect it from infection. If the person is unconscious and their airway might be blocked, tilt their head back slightly and lift their chin to open the airway. Remove any visible objects from their mouth if possible. If they are choking and no tools are available, give firm back blows between the shoulder blades or perform abdominal thrusts to clear the obstruction. If the person is not breathing and has no pulse, perform CPR. You can do chest compressions by pressing down hard and fast in the center of the chest, about 2 inches deep, at a rate of 120 compressions per minute. If you are trained, give rescue breaths by pinching the nose shut and blowing into their mouth until their chest rises. Managing shock is also vital. Keep the person lying flat with their legs raised if possible to help blood flow to vital organs. Cover them with clothing or blankets to keep them warm and reassure them to reduce anxiety. For injuries like sprains or swelling, use cold wet cloths, soaked clothing, or even a bag of frozen peas wrapped in a cloth to reduce swelling and pain. If someone has low blood sugar and no glucose tablets, give them sugary drinks, sweets, or juice to help raise their blood sugar levels quickly. Remember to follow the DRSABCD action plan. Check for danger, response, send for help, airway, breathing, CPR, and defibrillation if available. Even without supplies, knowing these steps can save lives. Using what's around you, like clothing or your hands, can make a real difference in emergencies. Staying calm and acting quickly can help stabilize someone until professional help arrives.